Welcome, and thank you for joining us today for the Coordination Connections webinar, Building Transportation Capacity in Rural Areas with Public and Private Partners. My name is Carrie Diamond, and I will be moderating this session today. Just a few basic instructions for Zoom. Everybody is muted. The session is being recorded, and all of the materials for this session will be on the NADTC website. Closed captioning is available. You can turn on captioning or subtitles with the CC button at the bottom of your Zoom panel. I also posted in the chat the streaming text link if that's how you prefer to receive the closed captions. We ask that you put your questions in the Q&A box rather than the chat, as they're easier to follow and we don't lose questions, but the chat is open to be used for general comments or technical assistance. A little bit about the National Aging and Disability Transportation Center. Our mission is to promote the availability of accessible transportation options that serve the needs of older adults, people with disabilities, caregivers, and their communities. We do this through a variety of technical assistance activities, such as webinars. We do this through training. We have multiple courses that are online at this point. Communication and outreach. We have a newly designed website as well as an e-newsletter that comes out monthly. We work a lot in coordination and partnership and help to build those among people who call us for technical assistance. And then we have investment in community solutions, which includes grants that we offer annually. A little bit about what brought us here today is this year, NADTC undertook a coordination campaign. This is a national campaign to provide education and technical assistance about coordination activities. These activities of the NADTC were driven by a national coordination advisory committee who helped us as we are crafting tools, resources, case studies, promising practices, as well as these webinars. So why did we put together this coordination campaign? Because a lot of the programs out there are already coordinating among human services and other providers to provide the transportation that they do. It is a requirement for Section 5310 projects to be in a locally developed coordination plan. And we know a lot of people are already doing coordination. As there is a recommendation from the Government Accountability Board last year in their report about better coordination. And then supporting the continued activities of the Coordination Council on Access and Mobility, or CCAM, which has a variety of very useful resources such as their program inventory and their fund rating guides available on their website. So our Coordination Advisory Committee is made up of professionals from local, state, and national level, both public and private. They have been the ones working with us throughout this year to provide recommendations and really craft the resources that will be useful to you on the ground. They keep us grounded in what matters to communities and what matters to practitioners in the field. We're fortunate today to have with us our speakers, Charles McCarthy, who is the Mobility Manager of the Northwest Colorado Council of Governments, and Josh Massey, who is one of our Coordination Advisory Committee members and the founder and CEO of Carepool. So now I will go ahead and hand it over to Charles. So if you want to go ahead and unmute and take it away.
Yeah, thank you, Carrie. So my name is Charles McCarthy. I'm the Mobility Manager for Northwest Colorado Council of Governments. You can go ahead there, Carrie. And so in our Regional Coordination Council, these are the counties we cover. So we cover the counties of Routt, Garfield, Egan, Pitkin, Grand, Jackson, and Summit counties. Now we do some work with counties outside of the RTCC counties as far as helping them build up their councils and helping them build up their coordination efforts and things like that. But these are our main counties, and you can go ahead. So who are we? So the Northwest Colorado Council of Governments, we're a voluntary association of county and municipal governments. Individually and collectively, we work together on a regional basis, and we help provide benefits to those who couldn't obtain those alone. And you can go ahead.
That's the last slide I have for you, Chuck.
Oh, okay. All right. So I wanted to give you guys a little bit of background into what we do and what we're doing now in Colorado. So when I started in 2019, we had the one call, one click transportation center. And what we did is we developed and we helped find transportation, broker transportation, if you will, for all the counties we serviced. So what would happen is clients would call us or hospitals would call us. And what we would do is we'd coordinate their transportation and we'd set them up with a transportation broker in their area to get back and forth. And if they were driving themselves or having a family member drive them, what we would do is we would go ahead and make sure they got reimbursed, make sure they got there and back, make sure they got reimbursed for their food and their hotels. Now that's great. And that was, it was amazing. The work we were doing was, it was just, I was excited to be part of it. So 2020 came around, and once 2020 came around, Health First Colorado decided that they were going to have one broker for the whole state. So that was in Telluride. So that kind of shut out all the small brokers. So this is where I start with how we kind of went ahead and evolved into what we are today, which is a fully informative resource center. So what we do now is we work with transportation entities such as Josh Massey from Carepool, who you'll hear from shortly. And what we do is we help them set up in the area of their area of responsibility, which is going to be our area of responsibility. So the first thing we do is we get the general needs of the area. So once we know what the general needs of the area is, whether it be RTCC, whether it be trips to the doctor's office and grocery stores, we kind of try to get exactly what the needs are going to be. And then we try to potentially fit the transportation providers into those needs. So what we would do is we would sit down with Josh. We would find out what his needs are, what his company is looking to do, where they're looking to expand, right? And their availability. Are they available to do NEMT? Are they just available to do taxi services? Things like that. And then once we get that, we bring it to the council. So we'll bring Josh to the coordinating council, have Josh sit down, explain what they're doing, explain what they're looking to do, what they're looking to bring to the area. And then from there, we try to launch it. Now, that's what we're doing with the providers. Since we're no longer doing brokering, what we've tried to do is we tried to evolve the brokerage into an information program. So what we've done is we've developed a website that's fully informative. Everything all your questions, everything about where your transportation can be found, what the phone numbers are, those are all going to be found on our website. We have informational brochures. Those brochures break down exactly what transportation providers are in the area by county. So if you're in Routt County, you look up Routt County. It has all the transportation providers, whether they're non-emergent medical transportation or they're taxi cabs or buses. All that information is found on their website or on our website rather. And then we have our phone number. And what we're doing with that is, even though we're not a brokerage anymore, we still answer the phones. We still man them 24 hours a day. I check my stuff in the morning. We get phone calls. And then I make sure that we direct those direct those clients into their respective areas. So what we're doing is instead of setting up the client with the providers, what we've learned how to do is give the information to the clients themselves and help them do it, since we're not a brokerage anymore. So that's kind of how we've evolved into what we're doing now. It's been really interesting. It's been fun, and it's been eye-opening. We had to figure out how to reevaluate and re-engineer everything, and it's been a tough process, but the way we're doing it now, with giving all the information directly to the clients and the clients being able to have the information directly in their hands, isn't just helpful for the clients, but it's helpful for the families as well. So now you have families that have all the phone numbers, all the information and things like that. And it just kind of helps the clients out.
Great. Thank you, Charles. I am going to ask just two points of clarification. Can you provide the structure of the RTCC, what that organization is, who is involved in those regional transportation coordinating committees?
Yeah, absolutely. So we have representatives from all of our major transportation entities. So what we do is we have representatives from transportation entities. We have representatives from hospitals, which are caseworkers. We have representatives from Northwest Colorado Center for Independence, NWCCI. And what we do is we bring them in and they bring us the needs. So for example, we just launched our gap analysis. So that gap analysis and needs assessment, that went out to everybody in the RTCC. That's also available on our website. And what that does is that helps the transportation entities and those caseworkers to look at where the gaps in service are. Once they bring us those gaps in service, we can go ahead and try to develop, try to fill those gaps, if you will.
And I'm sorry if I missed this. Who's initiated and is paying for that gap analysis study?
So we actually, we're paying for it through our grant. So what we do is we do a 5310 federal funding or mobility management grant rather. And we do that, and that helps cover the cost of the mobility manager salary, as well as things like gap analysis studies, the brochures, the website development. All that gets done through the 5310 mobility management funding. And like I said, that also helps cover the salary. Now, in addition to that, we also do a funds matching every year. So every year we do a $4,000 funds match with our transportation companies. So what they do is we match their funds, and that's a requirement through the 5310 mobility management grant that you have funds matching. So that's another avenue where we get funds to develop the brochures, the website, the studies, so on and so forth.
Great. Thank you. That's very helpful. So now we will transition over to Josh. So I will go ahead and bring up your slides here, and we'll let Josh take over from here. Thank you.
Sure, thank you. Appreciate that, Chuck. And yeah, I'm just going to give a little bit of a background, kind of give you a preface of where Carepool came from and kind of how we coordinated here. So myself, I'm Josh Massey, founder and CEO of Carepool. Well, because background, I come from a rural Wisconsin. So you really know you have to figure out transportation if you want to see the world. And so I just got an early age, got into transportation itself and kind of studying, ended up in technology in Chicago and working with transportation technologies quite a bit. And well, at the same time, really Uber and Lyft had come to town and kind of changed how we got around the city, where we would go, really how you schedule your workday. And so it was really fascinating to me, but also at the same time was talking with my grandmother in Wisconsin. Really tough for her, taking some different rides under Medicaid, and just kind of wondered, why can't we use this similar model to create something within rideshare where sometimes you have good experiences, sometimes you might not have a good experience. It can feel random. So I was wondering, why can't we use more of a trusting base of drivers and kind of build it off of relationships and consistency? We can go next slide, Carrie. Thank you. And so after Wisconsin had passed the laws around rideshare and TNC certification laws, moved back to Madison, started the first rideshare kind of in the Midwest. And at the same point, I got a phone call from Health and Human Services, and they had said, Josh, we want this model really focusing around people with disabilities, aging populations, and then rural areas, really as I was thinking as well. And so turns out that over half the people they surveyed in the state of Wisconsin just couldn't get the proper transportation that they needed. And that was kind of across both aging and disabilities across the state. Next slide, please. And we all know what this can create, right? You're missing appointments, you have ongoing health issues, really tough to maintain employment if you have to depend on just family to get you around. And for disabilities, really a high level of anxiety with less inclusion into society overall. Next, please. So our solution, sorry, the slide got a little jumbled in conversion here, but really it's just our solution was rideshare technology, right? It's apps, on a phone, but also can work on any internet device, so laptop or tablet. But we have kind of a custom software that is more pre-booked. So the drivers can see the profile of the rider ahead of time. They can see that they may have certain things that they need, a special need, or just kind of, any information that would be helpful on that pickup. That individual needs to be left attended. They need assistance getting in through the door, that sort of thing. But kind of just a mix where, if you think traditional rideshare, you're only thinking technology, right? You're thinking, hit a button and on demand type of thing. And so we're kind of a hybrid of that. So we do have concierge scheduling, like you can answer the phone, we can help someone book a ride through our software. And then even on the back end, if they are not very technical, if they don't have a smartphone, a lot of times people will have a flip phone anyway, you can receive text messages. So our software does push through text messages similar to Uber and Lyft, just showing, hey, here's the driver you're going to have, here's how long until they get there. And then kind of, really be able to secure that within their entire group. So multiple people can receive the text message in their care group and that sort of thing. But yeah, next slide, please. So our current coverage map here, we're kind of in the expansion mode and just getting launched here in Colorado. We did expand from just Wisconsin a couple of years ago. Then during the pandemic, we started helping with pandemic response in Tennessee and kind of developmental disability division there. And then this last year, we expanded to Kansas and Indiana, both on some disability type grants on the county level. So we're just kind of looking at, new next phases and next places to expand. I found myself, quarantining as well in Colorado during the beginning of the pandemic. And then I just, as I was working with public health in the state of Wisconsin and Madison, it made me realize like I was getting push notifications for Eagle County where I was staying, and they were having some similar big issues. And so I kind of just decided to reach out and just say, hey, I reached out to public health and just made a phone call. And I was just really taken away. Like, it was just really cool how connected the counties felt. And like, so as soon as I got a hold of one woman that was, I think, just Eagle County and maybe just the aging side, really quickly, I was introduced to the head of kind of the aging divisions for all 5 counties in a regional manner. And then kind of from there, Aaron had been working, that works with Chuck, had introduced me to him right away. And, just really felt like, wow, this is something new and different, like how they're dealing with, a 5 county, really rural region, but then coordinating at such a high level. And that kind of just led me and brought me in. And so they kind of had me start presenting and from there, that's kind of led to us now launching in the area and figuring out where some of those gaps might be. And that's kind of what brought us here where we're at now today. I think that's my last slide, Carrie. Yeah.
Yes. So thank you. So Josh, a couple things. So the Carepool, is it an app on a phone, but then people can also call in?
Yeah. So it's an app on a phone, but it's called a web app. So you don't download it. It's a Google kind of has this website integration thing with web apps now where it looks just like a regular downloaded app, but this way it can work on any device. Yeah. So a lot of people use their computer to book, but then they also can make phone calls to us, and then we can help them put the ride through the software as well.
And then the vehicles that you're using, they're independent contractors? Is
Yes,
the model? Okay.
Yep, just the same thing as Uber and Lyft. So they use their own vehicles. We provide $1 million liability insurance on top of that for every ride, managing that piece. And then we also, of course, with the disability world, we need to have accessible vehicles. So we have partnerships in every local area we're at. And so then we also bring, drivers and providers that have accessible vehicles for wheelchair, sometimes even stretcher. And now we're, doing some things even with kind of COVID positive transport and trying to, really kind of customizing the transportation system as it's needed locally.
Right. So Charles, Josh had said that when he got to the area and started asking the questions, he experienced how everything was connected. He quickly got connected into the pipeline. What would you attribute that to from your end, being in Colorado, that it was so developed already? Is that something the RTC or just the network that you're in?
Oh, that's partly the network we're in. Part of it is the network we're in. They got Josh connected to Aaron, and then once Josh was connected to Aaron, then that's kind of where we fall in. And once we get connected with someone, I try to work extensively on it as much as I can. So like Josh will tell you, we were in constant contact. We were sitting down having meetings. We were constantly talking about, okay, what are you looking to do while you're expanding? Does that meet our needs? Does that match our needs? And I want to get that in as fast as possible. And the reason why is because in these rural counties, there's little to no transportation. If you come out to Summit in Eagle County, you're going to see a whole, even Pitkin where Aspen is, in some of those places, you'll see a lot of transportation. But one thing I quickly realized when I moved out here is outside of those resort areas, there's little to no transportation. So once I get a transportation provider in the pipeline, I want to try to get him connected with as many people as I can, as fast as I can. And the reason why is because without this central brokerage, I can't just reach out to like one or two people. I can't just book it online and then, hey, let's go, for the trips. Now it's got to be, we got to connect with the transportation entities themselves, work directly through them. The client has to work through them. So once I get a transportation provider in, I want to try to plug them in with the RTCC and the needs as soon as I can. That's why the framework works so well.
And Josh, from your perspective, again, without Charles and the RTCC telling you what rides are available and the needs in the community. Was that a big attraction for you to do business there and to come into that area because you knew the needs? How did that, from a private perspective, how did that, Jade, how is that influence over your business expansion?
Yeah, it was absolutely a big part of it, kind of just having all the proper information, because I've noticed in the past, whether it's, different states, kind of each county might operate very independently and you might not understand all their needs depending on who you're talking with. And so that really right away, having all the stakeholders at the table, getting me in a meeting and a Zoom with everybody involved, whether it was, you know, hospital stakeholder or, you know, for the aging or just everyone coming together. I mean, it was much more informative right away to be able to understand where are the gaps and where would we be able to fit in. And yeah, it was just very impressive on how they were able to coordinate so quickly and how everybody in that large of an area is coordinating together.
Great, thank you. On that coordination vein, so Charles, in the large area that you serve, is there a secret for keeping everybody coordinated and engaged and working together, including, I believe, public health is part of your network there?
Yeah, no, I don't think there's a secret. The secret is that there's no transportation in the rural areas. And so in order to facilitate seamless transportation for everyone, everyone needs to work together. And we all work together all the time. The Health and Human Services coordinators and the county commissioners, we all work together really well and really quickly, and everybody is on the same side. We know what the issue is, we know what the problem is, and we know how to solve the problem. So that's kind of where that seamless transition comes from, and keeping everyone on the same page all the time. Is that, I mean, when it comes to our clients, the main thing is getting them where they need to go, right? When they need to go there, make sure they're getting reimbursed, following up, so on and so forth. And because that's so important to everyone that I work with, whether it be commissioners in other counties, whether that be Health and Human Services, whether that be hospital stakeholders, because it's such an important and impactful issue, everybody kind of jumps in immediately. Like there's no hesitation. I mean, I'll email someone and I'll get an email back, you know, an hour or so later. Everything is really quick, everything is seamless, and everyone is excited to work together because everyone wants to solve these issues.
Mm-hmm. So you had gone from a ride provider to now you're doing, and you posted the website in the chat box. You're just doing information and referral at this point, correct? And then the coordination work?
Yeah, so we weren't giving the rides, we were coordinating the rides. So what we were doing is we were acting as a call center. And when we had 5-6 transportation entities, someone would call us up, they say they needed a ride on this day, and we would coordinate in a system with the independent transportation providers. Well, since we're no longer doing a brokerage, right? Since we're not getting funded to operate a call center with multiple people, we had to come up with a way to facilitate all this information about transportation without being able to do it live. So what's the second best thing? Well, we update a website. That website is constantly updated on Fridays. I update the website. I update all the links. I update all the news. That way, everything is in one place. All the information that we were able to give you via phone calls and things like that, which we're still doing, mind you, we're still answering phone calls. Instead of brokering the rides, we're giving you the tools to be able to broker the rides. Now, that doesn't mean that I don't still get phone calls, which I do all day long. And when I do get those phone calls, I tell them exactly which transportation provider to go to. The only difference now is we're not actually booking the rides ourselves. What we're doing is we're giving the clients or the families of the clients the tools to book the rides.
Okay, all right. And since the large broker has gone away, have you attracted other private providers, and are you also using human service providers in your counties?
I'm sorry, can you repeat that? I didn't.
So have you attracted other private transportation providers, and are you using like human service providers in the area, whether it's an independent living center or other nonprofits perhaps?
Yeah, so we use other independent transportation providers, health and human services that do provide transportation. We do utilize them, but for the most part, we utilize companies like Carepool, like Josh has, which does non-emergent medical transportation, because that's the majority of what we get. Now, we still have a need for transportation other than non-emergent medical transportation, and we don't really field calls for that too much. All of that's on our website for the most part. But as far as like recruiting new providers, we have the providers in place right now. Now that we have the gap analysis out, we're going to be working towards filling more of the gaps that we see. But as it is right now, we're doing pretty well with the providers we have. Not that we can't use more, but the thing is the providers we have, they're servicing a larger area than was done before Intelleride, who was the broker that took over for us. Prior to Intelleride, we had each county kind of had their own providers. Now we have providers that are coming in and taking over 5-6 counties. So because we have providers like Josh's Carepool that takes 5 counties, you know, that kind of helps out a lot.
Okay. And if somebody isn't able to book online, I mean, you're sending them to another service. Are your mobility managers able to help them schedule a ride?
Yeah, absolutely. So for me personally, if they're not able to use that and they can only call, that's what I was alluding to earlier. I will help them. Like if they can't use the internet or something, I'm still going to give them the phone number. I'm still going to reach out if needed to the providers independently and try to get them connected. Even though we're not doing brokering, that I'm still doing everything I can to try to broker the rides for the clients. And that's another reason why we work so well in this area, is because everyone does that. Everyone understands that, hey, if a client needs help, can't book a ride, can't use the internet, you know, what are we going to do? We're going to work with them. We're going to help them figure out how to get that ride. So
thank you.
Yeah.
One more question, then I have a few, several for Josh and about Carepool, but just one more. Charles, you had mentioned the members of the RTCC. So the rides, maybe you can share with us a key point that the gap analysis showed, but the rides that you're finding, the gap in rides, are those all medical appointments? Are there for people with disabilities? Are there, you know, it's like, are you finding maybe a few rides here from this agency, a few rides there from this, and then you kind of compile them and say, hey, we have this volume of rides for private providers that are coming in?
So the majority of one of the biggest key points for the gap analysis is that there's no intra-county transportation for transportation providers outside of NEMT. So aside from like taxi companies, like bus services, for example, bus services outside of like Summit and Park County, where you have Summit Stage that comes into Park County, and I think they might go into Leadville. They go to Copper Mountain. Most of the transportation companies, by and large, they don't go out of the county. So if you work in one county and live in another county and you don't have a ride, that's one of the biggest points of contention. So that's something that we're looking to solve. Another thing is, another big issue we have is travel training. When we had a call center people could call up and, they could get the rides whenever. Now they can still do that, but it's only manned with one person instead of being manned with multiple people. So what we're trying to develop this coming year is a transportation training program, and that's going to help. That's going to help everyone from seniors to anyone else on where exactly to get the transportation in their area, how to get there, how to book it, all the step-by-step guides, including how to ride the transportation. And these are some of the key points that we just found out that we're trying to go ahead and get a handle on.
Great, thank you.
Yeah.
Josh, we have several questions here about Carepool, and let's start with your drivers. How are you recruiting drivers, and what type of training do you require of your drivers?
Yeah, so I guess the short answer is we have to recruit, and we have a pretty big recruiting team kind of internally that focuses only on that. And I think it's kind of a trend in general right now, but yeah, so the independent drivers, we're recruiting them with their own vehicle, and that with more the ambulatory rides, kind of pretty basic as far as the separation. We do need to separate, I guess, the ambulatory riders and drivers with those rides versus kind of the next step up. So we train with, I guess, a lot of CNAs and nurses kind of as our initial drivers and like lead drivers in the area. Then we do put them through other training if they don't have it, such as CPR and really just, any state requirement, we do train them up. We also have kind of a program that allows them to get kind of to the next level of driver I was speaking of. So if they want to do more of like actual medical rides or hospital rides, there is different training required for that as well, to how to secure a wheelchair, how do you transport someone in a wheelchair, how do you use these types of vehicles, so that we initially try to recruit kind of medical leaders in the area locally, some that might be, close to retirement or just looking for a change, kind of from the medical world, but still want to help people. So a lot of recruiting efforts and then training is definitely ongoing, and we're, trying to figure out kind of new ways to get them, say, maybe they didn't have college career behind the medical world. Well, if they can get certifications and kind of move up within and learn that they like it, this is a opportunity for them to kind of get into that healthcare world without necessarily, having the background in it.
Thank you. And you had mentioned that the drivers use their own vehicles, but you also mentioned that there's wheelchair accessible vehicles and stretchers. Is that a group vehicle, or how are those rides provided?
Yeah, so we've built the next level kind of around the different hospital systems that we were working with. So we, for example, we have a contract now with Ascension hospitals nationally. So with them, they use Lyft. Sometimes they have a partnership with Lyft too. So if someone's just purely ambulatory, they're going to be able to, put them in a Lyft and they'll get home safely. We're kind of looking at anytime it's rideshare plus, we're calling it, like anytime they need more assistance, anytime there's something more of a level than just the driver shows up curb to curb, the ambulatory patient can get in the car themselves. So yeah, the next level is more that wheelchair accessible level. So there's within that, we're kind of figuring out that rideshare and kind of how the insurances work still pretty new on some of it. So we do have some drivers that with their own vehicle, they would be willing to do wheelchair transfers and get the training to be able to do that. So that's kind of one of the first things. If we're looking for a discharge, they might say, hey, we need a wheelchair transfer. Can you provide the wheelchair? Can you come and help them? And they can transfer, into the vehicle. It's just they had a procedure. They're not wheelchair bound. So we're kind of looking at the different level of, okay, we can use a regular vehicle and do a transfer. They can have a wheelchair in the car ready to help. But then kind of that next level is where there's just kind of a breakdown of the model. There's nothing right now that exists that you can just say, hey, it's a rideshare vehicle, go grab it. And then, insurances are covered to do wheelchair accessible rides. There's just not really insurances around that non-owned policies yet, but we're really working on towards that. And I think that's probably what we're going to be able to do in the future. But right now we have to have kind of subcontracted providers. So a separate entity, separate company they generally just own the vehicle and employ their own drivers. So kind of, that piece is, I think, where a lot of innovation will happen in the next steps, next stages. Like within, like one example would be Milwaukee, Wisconsin. We have a partnership with the large taxi union so that they have all these wheelchair accessible vehicles. And sometimes they just, troubles either finding the drivers or, kind of they're busy with the rides they have, but they have vehicles sitting there. So we've found that we can get our drivers credentialed for both a taxi as well as rideshare. So they can, if they get paid more, to say Ascension needs a discharge, can you get there within 90 minutes? They're going to go to the taxi union, switch their car, grab the wheelchair vehicle, and then they can go deliver that ride. So that's one model that we figured out to be able to use, but it's just, there's a lot of kind of gray area stuff that isn't quite defined yet that we're trying to work through.
Great. I love that. Coordinating, using the resources that are out there as well. The other question we have for you is, we'll get into the funding and the costs and that whole piece of it, but could somebody just call a Carepool like you would call an Uber or Lyft, or do you exclusively have contracts for the services that you're providing with a managed care organization or healthcare or other?
Yeah, right now, we've kept it pretty close to the vest as far as, working directly with a large health system and kind of more of an enterprise level. So we did build the software. So like for a care manager that might have to manage, 30, 50 people, they can go in and they can kind of book the rides for their members and they can book them recurring. So it could be a 6-month authorization for dialysis. They can go in and put all the rides in at once and it sends them through. So, I guess with the public, it will be a next step, right? Like kind of right now it's pretty much just, kind of invite only, but then kind of through the networks. If they say, oh, we have some another patient that wants to pay private pay, no problem. Like they can refer us somebody and we can pay private pay. So we've really kind of just, I guess, as we got this platform off the ground and it's been up and running over 3 years now, really just figuring out where were some of the hardest points to deal with first. And that ended up being kind of the Medicaid piece and just, kind of all the intricacies that go into those programs and billing back towards Medicaid. How do we create the model within rideshare that fits there? So I guess that, for now we've been pretty focused on kind of, working with like a managed care organization that might have 10,000 members and kind of regionally where their needs and kind of we can grow within that one organization. But I guess for us, the combination of having a health system, like a hospital system in the area, as well as the Medicaid program. And then kind of from there with those two staples, then we can kind of enter the market and then kind of expand. So I foresee it in the future being more available to the public and just kind of a regular downloadable app on demand, that sort of thing. But as we enter, we kind of, kind of step by step with kind of larger customers first.
Great, thank you. And so for the customers who are riding on Carepool, would they see, is there a cost to the customer or is it cost per ride or per contract to who you're working with?
Yeah. So it could be either or. It could be that they're just paying out of pocket for the rides. And a lot of times we look at it as kind of like a bus pass of, okay, you're going to need 20 rides this month, kind of sending just an invoice for a month's rides at once. And they can kind of have that, bank of rides. That's one way. And then kind of the other way would just be the customer is under Medicaid or Medicare or, through their health system that has a contract with us, they would just ride. They wouldn't have to pay on their end. We just we track it to their name. We pull the report and bill that back to the Medicaid or whichever payer it might be.
So you have the capabilities of billing multiple pay sources.
Exactly. And that's I kind of think the future of being able to create sustainable systems is like, you can't just keep one payer, for one provider and kind of, have one-to-one rides. I think it's really going to have to be, kind of how do we share across multiple entities and, share the payment where part of it might be a Medicaid rider, but then you're sharing a ride with someone coming from the hospital that the hospital is paying for it, or or their insurance is paying for it, and kind of splitting it between the different riders, and hoping that post-COVID, we can get back to that kind of model of more shared efficiencies, less vehicles on the road, and no no seats empty when you can. But yeah, I think that's really the best way in the future to make it sustainable, is how many payers can you get in there, and how can you split that? And it might even be employers, right? The employers can't get people to work, as easy, they can't find their employees. Well, if they could get them there, they might be able to. So the employer might be able to just to subsidize the ride a little bit, then the rider could pay an amount themselves. And we found a lot of employers like that, because instead of maybe having to raise wages a lot, they could kind of subsidize the transportation as a better option.
Great, thank you. I think that level of coordination is what we're all seeking across public and private entities. So Charles, a question for you. I believe you mentioned you're doing your services with 5310 funds, but can you talk about your funding structure, and do any of your funds go to help subsidize the actual rides?
No, so the subsidizing the rides comes from Medicaid. That's generally who subsidizes the rides. Usually the transportation provider will bill Medicaid, and Medicaid will subsidize that. As far as the 5310 structure, it's just the 5310 mobility management grant. And we can use that to build RTCCs, to build up transportation. It's not operating funding. It's not capital funding. So there's only certain things we can do with it. However, yeah, it's just a regular 5310 funding through CDOT. They send out the funds announcement at the beginning of the year or at the middle of the year, when the NOFA, notice of funding availability, comes out, and then we just go ahead and we apply through it through co-trams, and yeah, that's basically it.
Okay, thank you.
Yeah.
So for a one call, right now you're not necessarily doing a one call, one click center, correct, Charles?
Yeah, no. So the difference is, when we were doing the one call, one click center, we were, for everyone, we were answering the phones and booking the rides and following up and things like that. Now what we do is, if we need to, if someone calls up, we have the client, as long as they're able, generally they're just looking for information. We have the client book it directly through the transportation provider in the area. So I would ask them what area they're in, what county they're in. And if it's outside of my county of responsibility, I'll kind of figure out where they're going, who the mobility manager is, or the Health and Human Services department is. And then I'll go ahead and direct them that way. If that's a viable solution. If it's not, then I'll contact them directly, and I'll try to coordinate with the client and the Health and Human Services company, or the Health and Human Services. Yeah.
And Josh, maybe not in Colorado, but somebody was asking how the Carepool app can integrate with a one call, one click process. In any of your other work in other states, is it an option perhaps in a one call, one click center?
It isn't yet, but we definitely think we can get there. The state of Wisconsin has Veo as a new broker, and so they're more tech oriented, and kind of in general, we're hoping that we can get kind of more integrated in that level. Not yet. They just started, I guess, in November, but yeah, so not yet. But I think that's a really great idea. And within our software, we have kind of a call feature built in, and we kind of use Twilio as a backend, so that it provides text and calls, call routing. So I'm sure there's a way to do it. I mean, we have really great tech team, but then we also have tech partners. We have one that specializes in kind of more of the financial side, and kind of is able to do the split payment piece. And then we have kind of another that does specifically routing. So it's a lot of complexity, but yeah, I think we can do it.
Great. And Josh, can you talk about what you've done during the pandemic in terms of both the precautions that Carepool's taken with riders and passengers, as well as touch on, how you've been doing the COVID positive transports?
Ooh, yeah, it's been interesting. yeah, I guess we've been following all the CDC guidelines from the beginning as best possible. And then I even got into talking with some of there's some programs around kind of they're testing the airflow in vehicles and figuring out kind of how what's the safest way to transport someone in these regards. And so it just came down to kind of, I guess, figuring out everything we can, trying to be as safe as possible. And so obviously the first questions we're going to be asking someone if they're going to get in that piece of it is like, are you vulnerable to this? And, are, I guess, what's is vaccination status, something that you're worried about. So I guess, we've just had to kind of run with it, right? Just the best we could. I mean, we ended up having kind of like shower curtain type of barriers in the middle of the vehicles for a long time. And they, it turns out like sometimes just having the windows down on both sides is better, front and back, to just keep the airflow. We've had, certain drivers that wore like extra amounts of, PPE kind of protection. But, yeah, in general, we're just kind of finding people that wanted to do COVID response stuff too, right? Like we're, really like posting it as like, hey, COVID response team, and this is specifically what you'll be doing. Is that something you want to do? Okay, then, then we can take it to the next step. But yeah, it's been tough, trying to just hit it head on and finding people that, that understood that world and that were, either likely from healthcare and just, wanted to get involved, or just others that had the caring profile that saw the job posting that wanted to get involved.
And one more question, we'll end with this question to Josh, and then I have a little bit of wrap up to close up. But has Carepool coordinated with and/or considering working with a nonprofit when a volunteer driver program, say a local volunteer driver program, is at capacity?
Yeah, definitely. We've partnered with the driver programs and kind of seeing that there has been a lot of them that are at capacity. So we've kind of filled in the gaps there where needed. And, we've considered and we've looked at the option of them potentially using our software because it just helps the coordination piece so much and kind of the scheduling piece. And then kind of it would be like maybe they could turn it back on. They could say, well, our drivers are now busy, so they could open it up to Carepool drivers. Something like that is going to we discussed that pre-pandemic, just haven't really gotten to the next phase yet.
Interesting. So you're working with programs that are out there as well. Thank you very much, both Charles and Josh, for sharing your programs and your collaborations with us. Really appreciate it. In the chat, I've put a survey link if you could complete that for this webinar. I do want to let you know about TACKLE, which is the Transportation Technical Assistance Coordination Library. This is a collaborative work of the technical assistance centers listed here: the National Aging and Disability Transportation Center, National Center for Applied Transit Technology, National Center for Mobility Management, National Rural Transit Assistance Program, and the Shared Use Mobility Center. And this is where you can find all at this website, http://transportation-tacl.org. And you can find all of the coordination resources across the different centers. This as well was a response to that GAO report from January of last year. So thank you very much for joining us today. This is our contact information. We do provide technical assistance by toll free at 1-866-983-3222 or by email at contact@nadtc.org, or you can locate us at www.nadtc.org. We appreciate you joining us today. A link to this webinar recording and the materials and the evaluation will be sent out afterwards. Again, thank you to our presenters, Charles McCarthy and Josh Massey, for being with us today and sharing your programs with us. And have a good day. We'll now end the webinar. Thank you.